Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with Pete Mizell, the Senior Manager for Player Health at the National Basketball Association and an alumnus of the Johns Hopkins Bloomberg School of Public Health. Our topic is the bubble, how the NBA managed to complete its season and postseason without any interruption from the coronavirus, and what all the rest of us can learn from this success. Let's listen. Thank you so much for joining me to talk about the NBA season. Could you just tell me a little bit about your role at the NBA?
Sure. I work on all things player health. And so in normal times, it's typically our health policies, injury epidemiology, and really providing services to teams to make sure that the standard of care across the league is met in accordance with our policies and programs. It's all kind of flipped after coronavirus, which we'll get into.
Yeah, so your basic job is to help keep the players healthy. Is that fair to say?
Yes.
And that became an immediate challenge with COVID. Do you remember when the league shut down?
Yeah, we shut down on March 11th, fateful Wednesday.
Mm-hmm. Tell me about that. What was that like?
Well, we've been doing tons of prep work to kind of see where sports were going to go. And we were watching other leagues, particularly in Europe, and kind of learning lessons from how the virus was impacting sports. And so things were shutting down across Europe. And we were at the point where the decisions really needed to be made. Are we going to start playing games without fans? And then we had a positive test result. And by just a few hours later, the league was shut down.
Wow. And that was a big message to the country that COVID was real. The NBA played a pretty big role in getting people to pay attention.
Yeah. And I think, that's one of the things that I'm proud of. We take it very serious, health and players' health in particular. And it was great to contribute.
So you're at this point where there are no NBA games. And at some point, the conversation shifts to, might we be able to get started?
Yeah. And of course, we want to get playing again. And we know how important it is for players, for everyone involved in the league, for the business of basketball, and then kind of, for our fans and setting a message that we could get back to normal. So it was really important, but always the decision was, how can we do it safely?
I remember when you announced you were going to do it because my son broke into my room with the biggest smile on his face that I hadn't seen him with in quite a while. What was the thinking in how to create a bubble?
The hardest part was that we really had no idea what to expect. And with a bubble never really having done before, going into such uncharted waters was just incredibly daunting. We knew that it would rely on testing and the core health principles for safety first.
So let's just talk about the general areas you had to cover. So number one, you had to figure out where they were going to play and who was going to be in the vicinity of the games. Is that right?
Yeah. And I think the hardest logistics question to solve for first was, where is there a space big enough for what we needed to house the teams and the staff?
How many people were you talking about?
I think on campus at our highest point, we were around 2,000.
Okay. So you need a lot of room for people. You need the place for them to play. You need protocols to keep people from passing illnesses to each other. What were those kinds of protocols?
I think the most important first part of the protocol is the quarantine. The quarantine period was crucial in just making sure that once you step your first foot out of your room, that you're cleared to go. And after that, daily testing, strict adherence to mask wearing, and then hand hygiene and other things from the CDC are just crucial, and food safety and making sure that just every little thing was looked at. including how many seats could be at a table for mealtime and everything else.
So even with all those preparations, people still need to understand what they have to do themselves. So how did you talk to the players and staff to get them to realize the importance of following all those different instructions?
We put a huge emphasis on the education component of just orientation first, for everyone knowing what to expect, to know that this wasn't your typical trip to Disney World, and really trying to get the message through that this is all about the collective. Any single one of us could take the whole thing down, and we need strict adherence from every single person on campus to make this a success.
Were there any particular ways of getting that message across that you think were especially effective?
I think allowing the key stakeholders to communicate across their different teams was really important. And so the way that our program kind of unfolded, we would create educational materials, and then the teams themselves would have their own sessions and allow for as much time needed as possible for answering any wacky question, addressing any topics, and really letting everybody feel invested and heard.
So it was a lot of time spent, not just passing out flyers under people's hotel doors.
Exactly. And that happened until the end too. So as the science changed and as guidance from the CDC and other organizations changed, we would update accordingly.
I read a little bit that you had some of the people, not the players, wearing these sensors that would beep if they were too close to other people.
Yeah, the Kinexon, they made a big splash.
Yeah. How did that work?
So those are proximity sensors, and you're set up in teams. And so if you're an athletic trainer for one NBA team, for example, you could be within 6 feet of somebody on your team because you would need to potentially give them treatment. But if you're within 6 feet of someone from another team, it's set up where it'll beep. And it's kind of the same in those little rings throughout everybody on campus.
So it's sort of a mix of bread and butter education about health with high tech to try to remind people to stay vigilant.
Exactly. And also kind of the shock value of having something that's audible. It was important to get adherence and to let you know what 6 feet really is, because that's one of the hard parts of understanding a principle and then putting it into practice.
Got it. Talk to me about testing. How did that work?
So we had a partnership with BioReference Labs, and they set up on each of the NBA campuses, there was a testing center, and everybody was responsible for getting a PCR test every day.
So what did the testing show? Did you have positive test results?
So included in everybody on campus who was getting tested every day, we did have members of the community, Disney cast members, other people who were part of the day-to-day operations, drivers, delivery people, people who helped with the warehouse, all kinds of people. And so people in the community did occasionally test positive.
What about on the teams, the players?
No players and no team staff tested positive.
And that meant that you had at least their bubble really a bubble.
It was really a bubble. It really was. There were holes in the bubble, like when you got on a bus, but for the most part, it was a bubble.
And tell me about the research partnerships that the NBA set up to kind of pull this whole thing off.
Well, from the beginning, we realized that we were in a unique opportunity where our success would be reliant on testing, and partnering with institutions that were going to further testing and better understand testing was crucial for our success and would allow us to give back and make an impact in our communities. And so the first thing we did was partner with the Mayo Clinic early on, and we did antibody testing across the league. And then we really did some significant partnership with Yale, which has made some strides with saliva testing and Saliva Direct, which is now becoming available. And that was really impactful for us. It also helped significantly as we were having a few positives that would come in the daily PCR testing. We were able to sequence those with the researchers at Yale. And that was able to show that there wasn't any infection that was being transmitted across the people who were interacting with campus.
I see. Interesting. In other words, it was showing that there were different strains coming in, not one strain that looked like it was passing around.
Exactly. Yep.
Now, one of the topics that were reported in the media is just the stress of the whole thing, because people had to stay there. They really couldn't be coming and going if they were on a team, for example. I have a quote here from LeBron James, who I think put on Instagram, "I've had numerous nights and days thinking about leaving. I think everyone has, including you guys," meaning the media. "There's not one person who hasn't thought, I've got to get the hell out of here." So, it seems like, thinking from a public health perspective, you have the virus and you have everyone's mental health also. How did the league address that?
I mean, that was tough, and we felt it too. I'd say we had on campus almost the entire time, but definitely available the entire time was Dr. Derek Anderson, who is a leading mental health clinician and has great relationships across the league and with players. And so his presence, I think, can't be measured. It's really impactful. We tried to make as many resources as we could available to people who needed help. And then teams also have great infrastructure too. And so I know it was an emphasis from the NBA league office event staff, for our staff, teams making emphasis to do team building and really get through all of it together, because it was a strain.
That was, I think, as much as an accomplishment as all of the technology around COVID.
Yeah, I agree. It was a challenge. And certainly as you're there day after day, it wears on you.
So I want to ask you the final few questions on what has been learned from all this. I mean, I think it'd be fair to say that following the rules can keep COVID out of a particular physical location. Do you think that's fair to say?
I think so. I think we really showed the importance of mask wearing. Besides daily testing, the biggest emphasis that we placed as far as a health rule was on strict adherence to mask wearing, with few exceptions for players and coaches when they were basically on the court or actively eating. Everyone was wearing a mask at all times. And I think that really was important.
And what did you learn about the ability to maintain vigilance? We hear a lot about COVID fatigue these days, and the huge number of cases going up, people just saying, I can't keep going. You kept people in one place. I mean, they were able to stay in one place and keep going with all these different protections. What do you think you learned from that?
That it's really difficult, and it takes effort every single day. I think we might have had an advantage in that we did have a light at the end of the tunnel, being that Larry O'Brien trophy. And so, we really had something to work for. The players and the teams had something to work for. And, getting across the finish line meant a ton for us. But really, it's the daily adherence to the small things, and also contributions made from people across the league. We had coaches reach out and say, you need to change something about the way our meal room is set up. Feedback from players on little things that we can't measure. Was that what potentially stopped the link of a potential transmission? We have no idea, but all of those little things contribute.
Yeah. I'm curious, were there players who were real leaders in the public health side of this? When we think about players leaving on the court, but were there players who were able to, help with these various challenges, maintaining vigilance, keeping people's spirits up?
Absolutely. And you can see it. I mean, each team has its own personality, and the leaders on the teams, to be able to keep everybody motivated, keep everybody working hard, it was crucial.
In part, it sounds like what you're saying is we all need to find our own Larry O'Brien trophy, what it is that is at the end of this, that is going to keep us vigilant in the meantime. And if we can do that, then we can make it through very difficult circumstances for quite a while and give up a lot of the normal aspects of our lives.
I think so. And I think staying healthy can be that. I think for my colleagues and I, we had no chance at raising the trophy, but our goal was to keep everybody healthy, and that's what motivated us.
Great. Well, I think the NBA showed a lot of things. It took the virus extremely seriously at the beginning. It showed that you can maybe a slightly different, a normal, I forget what, a whole new ball game. I think that was the slogan, but a different kind of experience, but also really valuable, that connects with the kind of things we want to do in our lives. And also, it was really an example of the vigilance that we need to be able to make it through this.
Yeah, thank you.
Well, thanks for coming and talking with me about it.
Thanks very much, Josh. It was a pleasure to be here.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.